I've had the privilege of using many viewing systems, but my go-to system over the years has been the Volk Merlin system. The attributes I like about the Merlin system are the fact that it's very robust, it has a great engineering feel to it, and it's absolutely reliable. It inverts, it allows you to see, and you don't have to think one bit about it during the surgery. To me, that's the perfect tool to help you do these complex surgeries. You put it in and it just works flawlessly every time. The Merlin optical system has a number of features what I think is great. First, the working distance of the lens is very comfortable. I feel like we don't bump the lens. It's very easy to work around. Secondly, the lenses have proprietary coatings, which I feel that anti-glare especially is a major advance from what we used to use. Optical quality is excellent both for macular work as well as peripheral wide-angle work. And I've been impressed over the years at the quality of the optics for the Volk, both diagnostic and therapeutic lenses. Their coatings and so forth, it eliminates reflections and allows us to see clearly even under most challenging conditions. I use two main lenses. The main one is the wide-angle viewing lens, which allows us to see nearly to the periphery without peripheral indentation, and with a little bit of turning we're able to see quite far out as I typically need to do, where we don't anticipate needing to do peripheral work and we don't anticipate having to do macular work. That one lens allows me to do everything, including out to the periphery, shaving the vitreous base, as well as doing the posterior segment surgery. So typically a vitreous hemorrhage in a diabetic who needs endo laser, that's a very common case, and it's an excellent lens when you only had to get one lens. And finally, there are patients who have very deep set orbits where there's a challenge for degrees of freedom of your instruments. It's just very difficult to work. And the classic case for that is pediatric or neonatal patients, people who have a retinopathy of prematurity, retinal detachments, fever, or other kinds of diseases where you're working on very small eyes. For that, the small wide-angle lens can help a great deal. One of the big things that I've really liked about the Merlin system is that it can be a one-person use. The focusing system is very easy, it's very intuitive, and it's also very sharp and fast. So that's really quite easy. So the reliability and the quality of the view is obviously important. It allows us to concentrate on the pathology for helping the patient and having the best outcome.